Okay, we should be recording now. Let me just double check that. Okay. And yes, this is the webinar you are here for. I want to thank all of our wonderful co-sponsors who have helped promote this webinar. Thank you to each and every one of them. And this is our lineup. You will be hearing shortly from Anne, Christine, and Allan, our moderators, and our wonderful speakers, including Beirne, Sean, Will, Buky, and Aleksei. We have a very packed agenda. We're asking everyone to keep their comments very brief so we can get as much QA and discussion as possible. So people will be going through their slides quickly, but again, don't worry, you will have access to all these slides and you can peruse them at a much more leisurely pace when the time comes. So with that said, I am going to stop sharing my screen and I am going to turn this webinar now over to our fabulous co-moderators, Anne, Christine, and Allan, who will introduce themselves and get us going. Thank you so much.
Thank you, everyone. I'm Anne Christine Tedeschi, and Allan is with me here. And we just wanted to start first by thanking AVAC and thanking Jim and the Choice Agenda, as well as AVAC colleagues, Cinder Fewer and Annette Guardino. We began talking about this webinar a couple of months ago and the importance of bringing this subject to our larger global HIV community and health community. So I'm just going to let Allan introduce himself, and then we're going to throw a couple of slides up just to kind of frame this conversation about Project 2025 and its global dimensions.
Thank you, Anne Christine. My name is Allan Maleche. I'm based in Nairobi, Kenya, working with an NGO called KELIN that focuses on health and human rights, and looking forward to co-moderate the session and looking forward to having a fruitful discussion. I'll turn it back to Anne AC to move us forward.
I've just thrown my slides up here. Can you see them?
We cannot see your slides, Anne Christine.
You cannot?
No.
Just a moment. Let me go back to here. I'm attempting to share them here. Are you able to see them now?
No.
Not yet.
No? Okay.
It looks like you are sharing your screen now. There we go.
Wonderful. Sorry about that. So I'm just going to
always the charm.
Go through these quickly. First of all, my name is Anne Christine. I'm a journalist, a longtime HIV and global activist, and I'm also the founder of an organization called Gender Democracy and our campaign, Stop the Coup 2025. I'm going to not spend much time on this, just to say that we are a nonpartisan campaign, and I hope that after this webinar, those of you who wish will join us. We have a lot of materials about Project 2025 broken down, and we are moving to a multilingual site, so you can get that in other languages besides English. But our goal here is really this mission of public education and mobilization.
AC, I'll just ask you to move it to a slideshow so that it's bigger on the screen. Thank you.
Me? Allan?
Yes, just put it in slideshow mode.
Sorry. So in any case, here we're focused on mobilization, and we're really just talking about three things. One is, what do we need to do now about stopping Project 2025, preparing communities and stakeholders, and finally, making the point of whoever wins the US presidency, this is a vision for a longer-term vision for the Christian nationalist movement, and we need to be ready for it, regardless of who wins the American presidency. So just to talk about it, Project 2025 is a conservative movement plan for remaking America. It's also known as the sort of transitional plan of the United States, the Conservative Party. And it's a very radical playbook. It's backed by the Heritage Foundation and now 110 conservative advisory groups, as well as a lot of dark money. And really, it has four pillars. The one we'll talk about today, it's what's in the policy blueprint, nearly 900 pages, that wants to restructure the federal government. And the goal is to put the entire US policy on Christian pro-life principles. It has other pillars, which comprise an online recruitment database of conservative loyalists, a training program, and what has not yet been made public, which is a 180-day playbook of instructions about how they plan to do this going in on day one. here are some of the main things, and I've underlined the ones that I think are so relevant today. One, systematically dismantle the federal government, meaning all departments, which is essentially a soft coup. They want to reassign a lot of career federal workers and replace them with loyalists. Most importantly, they want to do this via executive orders. And they've already developed 150 executive orders that we know about that are ready to go for day one. Related to global issues, they want to criminalize and erase gender and LGBTQ identity from federal government protection. This would be a resurrection of the global gag rule, which will get talked about today. It's outlawing abortion to the extent that Congress will support restrictions. Finally, here, it also realigns all U.S. policy to reflect these Christian principles, meaning that it can, if you don't agree with that, you will not get U.S. funding. And Beirne will talk about that this morning. And finally, cutting funding for Medicaid, Medicare, and all federal departments. This includes HHS, CDC, FDA, and also eliminating vaccine mandates. So I'm going to turn it over to Allan to talk about some of the global dimensions. And we will be talking today about what are the possible implications and impacts, and what can we do now to prepare for the possibility of these reforms becoming reality next year. Allan?
Thank you so much, AC. And we know we've got very good speakers lined up giving global perspectives, especially those who have lived some of this experience already in Uganda, but we have seen the impacts of this particular trajectory that is being taken by those who are pushing Project 2025. We have seen the push to want to pass legislation in countries that criminalizes people, criminalizes behavior, and we've seen success in Uganda and Ghana, where they have managed to work closely with parliamentarians to be able to pass laws through under the disguise of protecting family values. Then we know their push is to have USAID to change to be pro-life and have a Department of Life, which will be keen around religious values and the right to life being sacred, which basically means pushing back on aspects around people having safe abortions. And then, of course, there are threats to cut funding to various groups and services for various populations, including important issues such as IVF that are quite helpful. And we continue to see the challenge that comes through with comprehensive sexuality education, even in the US, and also back here trying to bring back the same aspects. And then, of course, there's a fear that there is a resurrection of the global gag rule, which will be, for lack of a better word, more punitive, more stringent, and will affect really people who are getting money from the US government. And we definitely hope that we'll be able to discuss and have ways to see how to minimize this impact and how to prepare to address it. Back to you, AC.
Yeah. I just want to remind people that this is a Christian nationalist agenda. The entire policy and all of the ideology it represents Christian white nationalism. And within all this, we will talk about the racial and the white supremacy elements of this. It's a weaponization of religion. And we have seen this unfolding, as Allan mentioned, in Africa and elsewhere. And we have other speakers who will be talking about this, including Aleksei in Europe. So I'm going to stop sharing right now. And hopefully now we'll turn it over to our first speaker. We are welcoming Beirne Roose-Snyder, who is a senior policy fellow with the Council for Global Equality, and an experienced advisor and strategist working at the intersections of HIV, U.S. foreign policy, women's health, and human rights in the law. And just mentioned that Beirne and I have been talking for months, but she has been very active looking at the legal implications. Welcome so much, Beirne, to talk about the global dimensions of this policy.
Thank you so much, and good morning and good afternoon and good evening to everyone. I am going to try to share my slides. Always that question, whether it's going to work quickly for us all. Let's see. Jim, I'm not sure if it's going to go. I don't know that it's worth our time for whatever reason. The practice didn't save me.
Beirne, I can share your slides for you if you would like. If you give me a second, I can pull them up and you can get started, and then
That would be perfect. So
Okay.
I know that time is of the essence. We have so many wonderful people to hear from. So I will let Jim go ahead and share the slides. And I will go ahead and sort of start to talk a little bit about the foreign implications within Project 2025. But before I do that, we really have to start with now and the moment that we're currently in. And the branding is 2025, but this extreme rightward push in American politics is happening right now. So the landscape has deteriorated incredibly rapidly. Last fall, in a series of really extraordinary moves, the House of Representatives passed a funding bill that included a restriction on any group receiving U.S. foreign assistance if they provide gender-affirming care, gender-affirming surgeries, or promote transgenderism anywhere in the world with anyone's money. This is really radical, and it was unimaginable as a policy position even a couple of years ago. Now, it didn't become law last year because of the US Senate and the White House, but we'll call this the transgender gag rule, and we can discuss it a little bit more later. The moment we're in also includes former Trump administration officials who contributed to writing Project 2025, traveling the world promoting anti-LGBTQI+, anti-abortion, and anti-rights alternatives to international treaties, and sort of the standards that we've set together around the world. I commend to you all the work of IPAS on this in particular. Read up on their work on Valerie Huber's Protego and the groundwork she's laying for the next conservative president. Talking about this moment now also requires talking about PEPFAR reauthorization. So reauthorizing PEPFAR is normally done on a 5-year cycle, and it's different than funding for PEPFAR. Authorizing PEPFAR got derailed in 2023 for the first time ever by the same people who created Project 2025. The Heritage Foundation looked at 20 years of bipartisan, life-saving program and said, how can we extract political wins and fundraise off of this? So I have to take a tiny little interlude here to explain the fuckery that is abortion and US foreign assistance. No US foreign assistance can be used to provide or promote abortion as a method of family planning. This is called the Helms Amendment, and it's been true for 50 years. But for the last 40 years since Ronald Reagan, when Republicans are president, they further restrict the funds to poison the entire foreign organization receiving it, saying if you take US money, you cannot provide or promote abortion as a method of family planning anywhere in the world with anyone's money, no matter what your laws or treaties or requirements are. We call this the global gag rule or the Mexico City policy, though Mexico City definitely doesn't deserve that. And under the Trump administration, it was protecting life in global health assistance. So PEPFAR 5-year reauthorization was upended by intentional misinformation about these two restrictions. The Heritage Foundation and their lackey in Congress only wanted PEPFAR to be reauthorized with brand new anti-abortion restrictions attached, adding the global gag rule at a minimum. So for now, PEPFAR has been reauthorized as a program only until March 2025. It was a 1-year reauthorization with no new poison riders attached. But the program is diminished. It is diminished by misinformation, by Heritage, and by Representative Chris Smith, who should know better. This is perfect. Thank you. So this screenshot on the screen here is from a Politico article about PEPFAR reauthorization. And I think it tells us really clearly the moment we're in. Representative McCall is the conservative Republican chair of the House Foreign Affairs Committee. And he's saying on the record that he cannot get PEPFAR, a life-saving and bipartisan program he supports, reauthorized not just because of Chris Smith and other anti-abortion radicals, but because members of his own party would not want to do anything, including PEPFAR, that they think aids Africa. So the problem is captured and harnessed and articulated in Project 2025, but it neither starts nor ends there. So we can go to the next slide. So what's in Project 2025 about global HIV and AIDS? Not a lot directly. They don't say let people with AIDS die or defund PEPFAR, but they do everything to attack all the gains in human rights and data and partnership that we know have made the program a success. So they intend to expand the global gag rule, which has already done immeasurable harm to the HIV movement worldwide during the Trump administration. They intend to expand it to all of US foreign assistance, including humanitarian aid, democracy and human rights funding. They intend to expand it to multilateral organizations. They intend to expand it directly to US NGOs, and they intend to expand it to government funds. Those are all their words. Now, please don't assume these are even close to legal, but there are so many fewer checks and balances and legal challenges available in foreign policy than there are when my domestic policy colleagues will speak. Multilateral organizations attack is particularly notable here. There is enormous vitriol throughout Project 2025 for the UN, especially the WHO. So think about UNAIDS, about the Global Fund, about the WHO. They intend to weaponize all of them, and they don't care about the harm they cause to institutions or people or movements. So the expansions of the global gag rule are part of a broad anti-rights agenda. Super quickly, that will include, and we can sort of go to the next slide for a quick second. We expect this to include re-signing and leadership on the so-called Geneva Consensus Declaration. I can talk about that more. Aligning foreign policy with the Commission on Unalienable Rights. I can also talk about that more. And we also expect that transgender gag rule will be turned into a separate executive action. While Congress hasn't passed it, a president can, like the global gag rule, turn it into a unilateral restriction from the president on who can receive foreign assistance. So I don't want to leave people feeling hopeless, though I do acknowledge that a drink might be in order depending on your time zone. Now is the time to assess your own organizational risk in 2025, and I'm happy to help. Now's the time to talk with governments. They're bound to treaties, national constitutions and laws, and medical ethics over US contract language. This is especially important in this time of sustainability roadmaps and processes. Talk to your friends and partners and lawyers now to save disruption and lives later. So Project 2025 wants us to believe that if we only stop talking about abortion and trans people and cut off contact with groups and governments that work on abortion or with trans people, then the global HIV programs will be okay. But this is a lie. We know it's a lie because we know some of them don't want to do anything to aid Africa. We know it's a lie because the greatest successes of the HIV movement are not shiny new tech widgets, but the really hard-fought inclusion and, at our very best, centering of those most impacted, including our trans siblings. The greatest successes have been those that include adolescent girls and young women and all of their needs for information and safety and bodily autonomy. We know it's a lie because, like authoritarians around the world, they first attack the edges that they think we're least likely to defend, but they never end there. So I end it by saying hope is a discipline. This is a really bleak moment for what they intend for us, but I do have enormous hope for us and for us all working together in new ways. And I will leave it there.
Thank you. Thank you so much, Beirne.
Thank you, Beirne. That was really well done at a short time period. We'll now quickly turn to Sean Cahill, who's a Director of Health Policy Research at the Fenway Institute. He's also an Affiliate Associate Clinical Professor of Health Sciences at the Northeastern University and an Adjunct Associate Professor of the Practice in Health Law Policy Management at Boston University School of Public Health. Over to you. Your 7 minutes start now.
All right, thank you. I'm going I'm going to try to do slideshow. This thing is in the way. So give me a second.
Thank you, Sean.
You see the little remove spotlight there?
What? No, there's a bar in the way. Just hold on. Okay.
Just while
Well, I can't. Yeah. Hello.
Jim, can you assist?
There's a button on the bottom right you can click.
Which one?
It looks like a screen.
All right. Well, anyway, oh my God. I'm just going to go with no slideshow because I can't get it to work. Okay. So I'm Sean Cahill. Thank you for mentioning my affiliations. And so I'm going to talk about a little bit of background on the role of religious right organizations in developing this plan. And then I'm going to talk about specific proposals for HHS, and then just finish up with a call for action. Okay. So former President Trump has attempted to distance himself from Project 2025 in the last few days, as his campaign has done for the last several months. But it's important to note that this plan was developed by many former first Trump administration appointees, and that it's written by very influential right-wing advocates, including Russ Vought, who was director of the Office of Management and Budget in the first Trump administration and is being considered for White House Chief of Staff in a second Trump administration. He was recently appointed to be the to lead the play a key role in the development of the platform. Let me just try to delete this thing. Okay. Okay.
That looks good, Sean.
Okay, good. Now I can't get it to move. Unbelievable. Okay. Okay, good. So this is Russ Vought. I'm also going to shrink this. I'm very sorry for these technical problems. I've got a good presentation and I'm trying to share it with you. Okay. So President Trump personally blessed Vaught's agenda. This is a Washington Post article from a few days ago. Adam Mar-a-Lago fundraiser for his group, the Center for American Renewal. And the Washington Post also mentioned that Vought wrote the chapter on the executive office of the president, and he's developing the playbook for how to implement this agenda in the first 6 months of the next Trump administration. The Health and Human Services chapter was written by Roger Severino, who's a longtime religious right activist. He is at the Heritage Foundation now and was before he was in the first Trump administration, where he served as director of the Office of Civil Rights in the Department of Health and Human Services. He has been involved in many challenges to marriage equality and has argued that SOGI can be changed and that it should not, sexual orientation and gender identity can be changed, and that it should not be included in non-discrimination laws and regulations, and that such inclusion violates the First Amendment rights of religious conservatives. If you look at who's on the advisory board of Project 25, it's really a who's who of the religious right, including groups that have been active for the last half century in trying to restrict access to abortion and reproductive health, as well as equal rights for LGBTQ plus people. This includes Concerned Women for America and the Alliance Defending Freedom. And this is just an example from the ADL website. One of their key issues is marriage and family being protected. And they talk about ensuring that the law respects God's created order for marriage, the family, and human sexuality, which of course does not include LGBTQ plus people. It's also important to understand, as former President Trump distances himself from this really draconian, vitriolic agenda, that This really just takes the anti-LGBT policies of the first Trump administration to the next level. And those policies included prohibiting military service by transgender people, promoting religious refusal policies in more than $500 billion a year in HHS-funded services, and relentless attacks on the ACA, the Affordable Care Act, which helped millions of people living with HIV, LGBTQ plus people, people of color, and others access healthcare for the first time. Okay, so getting into specific proposals for the Department of Health and Human Services, Roger Severino says that HHS needs to restore and enhance conscience protection regulations to prevent providers from being compelled to provide gender-affirming surgery. In fact, no provider is forced to provide gender affirmation surgery or other forms of gender-affirming care. What they are required to do by the non-discrimination regulation put out by the Biden administration is to provide health care to transgender patients, but it doesn't mean that they have to provide gender-affirming surgery. That's just not true. Severino also proposes splitting the Centers for Disease Control into two pieces, one which focuses on collecting and analyzing epidemiological data, and the other focused on public health recommendations and policy. But it says that the policy piece of the CDC should have very limited power. And he's very critical of Dr. Anthony Fauci and the CDC and the public health leadership, including the CDC leadership during the COVID pandemic. And he says, how much risk mitigation is worth the price of shutting down churches on the holiest day of the Christian calendar and far beyond has happened in 2020? What is the proper balance of lives saved versus souls saved? So clearly, his religious beliefs are influencing his public health strategies. He also calls on the CDC to end collection of data on gender identity, which is absolutely critical for HIV prevention and other public health efforts. In terms of NIH, Severino calls for ending the NIH monopoly on funding health research and calls on Congress to block grant NIH funding to states. He denounces woke policies that hold sway at NIH, calls for the abolition of the DEI office, and says that NIH has been at the forefront in pushing junk gender science and that it should instead fund research on the alleged harms caused by gender affirmation. This is a consistent theme across many health and human services agencies that under a administration that's implementing this agenda, they will talk about how gender-affirming care is somehow dangerous and harmful. So specifically related to LGBTQ plus equality, Severino calls for Health and Human Services to repeal the sexual orientation and gender identity non-discrimination rule, which was just updated in May. Also calls for the removal of SOGI, as Beirne mentioned in one of her slides, for the removal of SOGI, DEI, reproductive health, abortion from all federal law, regulation, contracts, and grants. And this would have huge implications for HIV prevention. This slide was, this language was in one of Beirne's slides, so I won't dwell on it, but just mention that the section written by Kevin Roberts, who's the head of the Heritage Foundation, uses militaristic language like creating hard targets for woke culture warriors. And this is the person who was in the news a few days ago for talking about that they were in the process of implementing a second American Revolution, second to 1776, and that this one will remain bloodless if the left allows it to be. And so this individual, in his section of the report at the beginning, the foreword, used dangerous, extremely irresponsible, and dehumanizing language. And I'll just give you a second to read this, particularly the highlighted sections.
Sean, we're going to also ask you to wrap up here.
All right, I will. So he's calling for the criminalization of those supporting transgender youth, including educators and public librarians who are trying to be supportive of transgender youth. There's attacks on LGBT equality, attacks on gender affirming care, specifically calling on the Health Resources Services Administration Ryan White program to not allow funds to be used for gender-affirming care, calling on the Centers for Medicare and Medicaid Services to issue a strong policy opposing gender-affirming care and portraying it as dangerous. So thank you very much, and I'll hand it back to Will Ramirez.
I'm going to go ahead and introduce Will. Thank you so much. And just for everyone to know that we'll have a chance to talk about fighting back and strategies and exactly how the cuts in global funding may impact HIV. I just want to say Will is the Director of Public Policy and Advocacy at the Southern AIDS Coalition, and he leads HIV advocacy efforts there to amplify the needs and voices of persons living with HIV in communities that are disproportionately impacted. And we welcome him to talk about that and the impacts on HIV communities in the United States. Thanks, Will. Morning.
Good morning. Thank you, Anne. Give me a quick second so I can share my screen.
And Will, if you have problems, I will share for you.
Sounds good. Can everyone see my screen?
That looks fantastic.
Yes, we can. Well done.
Thank you. Thank you. So again, my name is Will Ramirez. I am the Director of Public Policy and Advocacy at Southern AIDS Coalition. Now, SAC is a nonpartisan coalition of government, community, and business leaders working alongside thousands of people living with HIV and their allies to end the epidemic in the Southern United States. We like to say that we operate as both a bridge and a megaphone for communities and community organizations. Now, all right, so Project 2025 is a lot of things. A lot of conversations can be had about the document, conversations from labor and worker rights to environmental policy and climate change. The president of the Heritage Foundation, Kevin Roberts, as Sam showed earlier in his slides, he said that the country is in the midst of a second American Revolution that will be bloodless if the left allows it to be. So that's something for us to be mindful of as not only we read this document, take this document in and understand the implications that this document has within it, but as we strategize towards the future, right? This document is a blueprint, is a strategy, but strategies can be countered. So there's two things that I want to be left understood today. One is that this is not new. It is part of efforts that have been going on since the 60s and will continue beyond this election. And two, there are things that we can do to prevent implementation this time around. But what sort of infrastructure, this is something we got to think about. What sort of infrastructure do we need to build to ensure that it doesn't get implemented in the future? Now, from the Southern strategy of the 1960s which was designed to exploit racial tensions for political gain, with policies like cuts to social services and continued segregation in medical facilities, which contributed to health disparities in the South, we have continued to see this sort of trend throughout our history, and it has always impacted the South with greater intensity than it has the rest of the nation because of several different factors that exist in the South that don't normally exist at the same level throughout the rest of the country. In 1970s, they gave us the rise of the Christian right and the moral majority. The moral majority was a movement that portrayed issues like abortion, divorce, LGBTQ rights, and equal rights as symptoms of a decaying morality of the nation. Now, these are themes that we continue to see in Project 2025 today, 50 years later. The 80s brought us Reaganomics, which had policies that cut taxes for high-income earners and corporations and heavily deregulated industry. It made huge cuts to Medicaid, public health, and other social safety net programs. It heavily impacted underserved and marginalized communities, and it was due in part to cuts to necessary programs and a generalized, stigmatized view of HIV, which gave rise to a never-expanding, ending explosion of new diagnoses throughout the nation and an ever-rising rate of deaths. Cuts during this decade undoubtedly impacted the response to the epidemic in the 90s and the following decades that came after that. The 90s gave us the contract with America, which is the introduction of work requirements which posed significant challenges for people living with HIV. This has made it more difficult for them to qualify and maintain access to welfare benefits that were impacted within that program, within the contract with America, which was a set of 10 different legislations. The reform also indirectly impacted Medicaid eligibility due to automatic eligibility linkage between welfare receipt and Medicaid, which was one of the concepts of one of the 10 legislations at the time. So why go through all of these? All of these strategies, which advocated for whole government change at the expense of diminished rights for already underserved and marginalized communities. We have seen this trend since the 60s, and this is just a new reiteration of that. And the only difference that we see with Project 2025, when we compare it to all these other initiatives that have been done by the Christian right, is that it is very well documented, it is very well structured, and that is very different than it has been done in the past. So now we have Project 2025, but it is also an attack on public health and the social safety net, and also a rollback of civil rights and protections. Those kind of impacts on HIV policy and health outcomes are throughout the document, specifically in the section that talks about HHS. So the efforts and proper funding have helped HIV rates diminish over the life of the epidemic. But despite that, there continues to be disparities in health outcomes based on race, ethnicity, gender, and class. Factors like for every 100 people diagnosed with HIV, 65 were virally suppressed. This is far below some of our global partners in this fight. So HIV outcomes continues to be an issue here in this country, and it continues to be an even bigger issue in the South. The fight that led to the fiscal year 2024 budget cuts that continued into this year and created a lot of momentum within the HIV funding movement. We have another looming fight coming up with the fiscal year 2025 appropriations fight. And we have to stay connected and join efforts to ensure that those sort of appropriations don't make it through. So the same sort of advocacy efforts that we engage in with the fiscal year 2024 budget cuts is something that we should engage in fiscal year 2025. Now, there are structural inequities that exist in the South that make this epidemic and other public health issues that much harder in the South. The South has issues of limited access to care with a combination of poverty, lower rates of insurance, and higher rates of stigma. And some of those policies proposed in Project 2025 have already been implemented in the South. So it's almost like the South has become the place where the policies are first laid out, tried out with these populations, and then implemented throughout the rest of the country, or implemented within this Project 2025 guidelines. Due to that, so it's almost, due to that, I think that the South is the region in the nation that can lead rejections of notions of Project 2025. So if it is successful, as we are successful in rejections, all these notions in the South, it makes us a lot more prepared, and it makes the fight a little easier to reject it in the rest of the nation. At least that's what I believe. In recent years, we've also seen an alarming trend in legislation targeting LGBTQ and trans communities throughout the country. In the South, this has been amplified. These laws not only criminalize identity, but also severely restrict access to healthcare, increasing stigma, and driving these communities further into the shadows. Project 2025 will only intensify these efforts, creating even more barriers to care and exacerbating health risks. As Sam mentioned earlier in his presentation, this Project 2025 proposes cuts to gender-affirming care funding under the Ryan White program. And just to ensure that everybody knows this, in 2021, one of the more than 500,000 people served by the Ryan White's HIV/AIDS program, 2.1%, approximately 11,600, are transgender. So our transgenders, brothers and sisters, need to be protected, and we have to ensure that these sort of changes don't go through. There's also plenty of attacks that involve racism and attacks on the poor in Project 2025. Project 2025's anti-DEI stance threatens civil rights and racial equality protections, which is vital for communities of color. Additionally, proposed restrictions on federal benefits like Medicare and Medicaid will hit the poor the hardest. We have seen this demonstrated in previous iterations of these sort of cuts. which would strip away critical supports in a time of growing need. These cuts will further entrench health disparities and reduce access to necessary services for the most vulnerable populations. Like the Southern Strategy, proponents of Project 2025 will leverage social issues for political gain, and the losers will be often marginalized or underserved communities of color and LGBTQ communities.
Thank you,
Thank you,
Will.
Will.
Would you please finalize that slide real quick? I don't want to cut you off in half a second. Over.
Okay, no problem. Well, I just wanted to mention that it's important for us to engage in advocacy, to engage with our communities, to engage in civic engagement, to vote, to tell our family members to vote, to tell our friends to vote, and to tell our colleagues to vote, and encourage active participation in policy discussions and elections. My name is Will Ramirez. Thank you very much.
Thank you, Will. That was extremely excellent. So, colleagues, we are moving on. We've got 2 more speakers left, and then we go to the question and answer session. And before I introduce the next speaker, just to remind you, if you have any questions or comments, pop them in the chat. The presenters are looking at them, and they'll be able to respond. So let me turn over to Olabukunola, former popularly known as Buky Williams. Buky is the Executive Director of Education as a vaccine, an organization that works with young people to advance their right to health and protection from all forms of violence. And he previously worked as the program coordinator for Nigerian women in agricultural research for development, and is also affiliated with AKINA or AFRIKA. Welcome, Buky. The floor is yours.
Thank you so much, Alan. And I think, Jim, you have my PowerPoint, but I'm just going to start. And I actually have left education as a vaccine, I've left the youth space. I now work for AKINA Africa, and I am the Section Reproductive Officer Rights Lead. And so today I'm actually speaking on behalf of Claire, who is one of the co-conveners for Convening for Equality. And so I'm here speaking on behalf of Convening for Equality, which was started in February 2023 and brought together Ugandan organizations, including AKINA, UKPC, and various organizations really who were looking at the horizon and realizing that Project 2025 was already being implemented in our countries, and that this was not something that was going to come when Trump is elected, hopefully not, but that this was already being played out in our politics. It was already being played out in the laws that we were seeing. And as you can see from this image, that's really how we felt, right? Because in 2023, when a document was leaked with the NGO Bureau in Uganda, and there was a list of 21 organizations, which included many partners who are now part of Convening for Equality, we realized that the passage of an Anti-Homosexuality Act wasn't just something we saw on the horizon, but something that was going to happen pretty soon. And 2023 bore that out. And since then, we've seen fire on the mountain in many ways, and we are trying to do our best to stay positive and stay hopeful. So you can go to the next slide. And what has happened from 2023 since then is that 2 reports have been released by the Strategic Resource Team under CFE to be able to document some of the violations that we've seen because of the anti-homosexuality bill. Because when the anti-homosexuality bill was being passed, a lot of the conversation really was like, oh no, it's not going to be implemented. Or because of the success of 2014 of the bill being struck down by the Constitutional Court, that we're going to see something similar again happen. But for those of us who were paying attention, who were reading the signs, who realized that a lot of our parliamentarians were already co-opted by these, by Trump officials, Valerie Hubbard being one of them, Family Watch International Sharon Slater, had already done a lot of groundwork. And as somebody who's from Nigeria and who already had a same-sex legislation that was also supported by Family Watch, we knew what was coming. And so in documenting these violations is really to show that this is being implemented, and there's been 1,253 violations, as you can see. in which there's been right violations, from evictions, from police raids, from being discriminated against at help points. And because the fact that a lot of the drop-in centers were closed due to raids, due to evictions, and people having to move back into COVID policy of being able to provide services, it has been really difficult for a lot of community members to be able to get access to information, to be able to get access to services. You can go to the next slide as well. This was just taken from the report. Thank you. It's being shared already in the slides, and you can see the impact that it's had on different community members. And the reality of what we're dealing with since the anti-homosexuality bill the act is already in full effect, and it's being used by the police. It is being used by local officials to harass those they perceive to be community members, and we're seeing more and more of that. And I think what is also pretty disheartening to see is that has meant that those who support the Anti-Homosexuality Act and those who are supported by Family Watch International and those who are supported by the entities who have developed Project 2025, Valerie Hobber being a key actor, has now just signed, an MOU with the Ugandan government on women's health, that, she wants to protect women's health, and that's who we're dealing with right now. And the president's wife is in cahoots with her. They just celebrate. She's in Uganda all the time, visiting women's hospitals and trying to say that what she's bringing is to support access to women's health. So again, I keep just saying that Project 2025, it's here. It is being implemented, and we are seeing it. Part of the fact that we saw quite a few politicians, both in Kenya and in Uganda, who signed a letter to PEPFAR saying that the funding should not be renewed, in particular, and all of those things are playing out in particular. And for those of us who are tracking it, various organizations have been doing so. We've set up what we call a rapid response task force in Uganda to be able to gather information, to be able to try and see ahead of the curve what is coming and what is happening. But even then, even paying attention to the signs of what is happening and what is ahead, it has been difficult in many ways to implement the strategies that we want, because it seems that even under the current administration, or even what is going on in terms of the far right, not just in the United States, but what we're seeing in the Netherlands, for example, what we're seeing in Germany, what we're seeing in the European Union, and the various political networks there, it is having an impact on the African continent. It's having a direct impact on what we're seeing in Uganda in particular. And so while we're doing the analysis, while we're doing the intelligence gathering, while we are trying to work together as various organizations to be able to inform politicians here, in terms of the language that is being brought, in terms of the legislation that's being brought by people like, for example, Sarah Opendi, who's bringing an assisted reproductive technologies bill just to reinforce gender binaries, just to ensure that people won't be able to access, for example, IVF services, to be able to push back against surrogacy, for example. When we see that, and we are trying to do the work to be able to, enlighten politicians, for example, to be able to ensure that various civil society organizations are aware of what's happening and are engaged in being able to push back and being able to do the advocacy necessary to be able to ensure that we can address these issues. I think even then, it has been very difficult. I'm just going to be honest. But I think what gives us hope and what makes it possible is that now at least the cat is out of the bag, right? All of the things that we have been saying behind the scenes, it's not very clear, especially with this Project 2025 document. It's very clear now that this is the agenda. This is what they're planning. This is what they want to happen. And now it's up to us as organizations, especially on the continent, to be able to speak up, to be able to find the support that we need in each other. For example, under umbrellas like Convening for Equality, being able to ensure that we are able to get lawyers on our side who are able to provide support to community members. It's also ensure that those of us who are in the various organizations, so for those who are working on abortion rights, for those who are in the feminist movement, for those who are working on comprehensive sexuality education, for those who are working specifically just on women's rights, that we need to work together, that they are coming for all of us, not just some of us, and that work is really necessary, and that we need to support each other, and that we need to find ways to continue to connect the dots, that it's also quite important for us to also work with the media as well, and to start working with journalists to be able to tell the stories, because often the investigative journalism that's happening, it's happening in the West, it's happening in other countries, but how do we ensure that it happens in our countries as well, to be able to connect the dots between what our politicians are doing, the agenda that they're pushing, the fact that people like Sarah Pendy are being supported by Family Watch, or that this law is not something that was homegrown per se, but that was something that was imported and brought to us. And the fact that they're using stories that our organizations are the one promoting a Western agenda, it's up to us to say, no, actually, they're the one promoting a Western agenda, like Project 2025. And that's what we need to push back on, because when we go to our communities, that is not what they say the issues are. For example, in Uganda, the issue that a lot of people are talking about right now is the corruption, and the fact that we have corrupt parliamentarians who are using the country's funds for their own benefit rather than using it for healthcare, rather than using it for education, or the issues of the finance bill, for example, in Kenya. Those are the important issues that should be discussed and should be talked about. And that's what we should be focusing on, instead of focusing on being the battleground for so-called Western civilization, or fighting for the soul of Americans necessarily, that we're not fodder for that continued battle. That
Thank you, Buky. Time is up. Maybe you could finish your last sentence real quick. I know time is really flying over.
No, it's okay. But I think for me, at the end of the day, what we are really hoping for is for us to connect all of these dots and be able to link together the efforts that we have together to be able to ensure that we're able to push back against this agenda. Thank you.
That's wonderful. Thank you so much, Buky. I think we will be talking about strategies more and more, especially in the conversation, but I just want to highlight one thing we haven't mentioned, which is, for those of you who are not aware, Project 2025 is very much modeled after the Hungarian autocrat Viktor Orban's regime. In fact, it's the people who did Project 2025 went to Hungary before, studied how it was done, and are implementing that. And actually, Orban has a contract with the Heritage Foundation. I'm bringing this up because our next speaker, Aleksei Lakhov, is representing EuroNPUD and is going to talk about that and the lessons that we are learning from Europe. He is the development director of the largest Russian harm reduction organization, Humanitarian Action, in St. Petersburg, and has worked in a number of other with a number of other harm reduction groups. Among others, he is a consultant to the WHO and the UN Office on Drugs and Crime, UNODC. And I'm really pleased to have you here today with us, Aleksei. We think that what's happening in Russia, the criminalization of LGBT, and also the criminalization of foreign NGOs, which now Poland and others are following suit, is something we've got to talk about. We know that there's a lot of positive lessons, and ultimately, we know that there's lessons of resistance. So we're welcoming you to talk about that and what you can tell us in terms of Russia's eyes on Project 2025, specifically Russian activists.
Thank you very much, dear fellow advocates, for inviting me to this important discussion. Do you hear me well?
Yes. Yeah.
Okay. So I will stop my video just in case some internet connection troubles. So yeah, my name is Aleksei Lakhov, and I'm representing the European network of people who use drugs. I have first-hand experience in navigating the challenging landscape of working in NGOs labeled as foreign agents in Russia. And I have since relocated to Germany on humanitarian grounds due to these very specific threats. And today I would like to share insights from these experiences, focusing on survival strategies of the civil society in my country. So the HIV situation in Russia presents a stark example of the obstacles that we face. Estimates of people living with HIV range from 900,000 to 1.5 million, with state-run HIV testing services covering less than 3% of key populations. Harm reduction projects have drastically reduced from 100 in 2007 to fewer than 10 today. These figures highlight not just the scale of the epidemic, but also the severe constraints imposed by the government. So the legislative environment for NGOs in Russia has been steadily getting worse during the last decade. Nowadays, the LGBTQI movement is deemed an extremist entity, whatever that means actually, leading to fines and criminal charges for even displaying rainbow flags. Social media giant like Meta is also labeled extremist, resulting in persecution of individuals for displaying its icons on website. Can you imagine? It's not a joke, by the way. One such case is unfolding in Yekaterinburg right now. Laws targeting foreign agents, undesirable organizations, and unregistered foreign NGOs create an environment where activists can be fined and even imprisoned for their work with such foreign NGOs and platforms as Open Society Foundations, Greenpeace, World Wildlife Fund, and even Global Giving. So in this challenging context, NGOs have had to adapt their strategies to survive. Key survival tactics include maintaining a low profile on social media. NGOs focus on general news about their work and share resources that are not banned. They avoid any symbols or references to LGBTQI+ issues to minimize their risks. Limited media engagement. NGOs engage only with non-banned media and restrict their discussions to non-controversial topics, such as HIV prevention among general population. Restrained advocacy efforts. To prevent repercussions, NGOs avoid petitions, open letters, and mass media campaigns. Advocacy is limited to behind-the-scenes efforts on the municipal and city level, ensuring their work continues without drawing government ire. Diversifying resources. Where previously NGOs depended on foreign funding for 90% of their budgets, today they diversify their funding sources, relying on private and corporate donations, as well as state subsidies, grants, and contracts, whenever possible or suitable. And of course, it's community focused, because despite the constraints, NGOs prioritize serving their communities over complying with government demands. This is an adaptation rather than conformism, and it is crucial for their survival and effectiveness. So, as we look towards wider Europe, we see the worrying rise of the so-called far-right movements in countries like Germany, the Netherlands, and Austria, among others. These movements threaten to undermine the rights and freedoms of marginalized communities we have fought so hard to secure. To counter these trends, we should adopt a proactive and strategic approach. Here are some key actions we could prioritize. One of them is strengthening advocacy networks, because building robust coalitions and networks is essential to amplify our voices. One of the examples is the Robert Carr Fund that provides support to regional and global networks and consortia addressing the needs of inadequately served populations. Another key action that we could prioritize is mobilizing communities, because empowering individuals through education, resources, and support fosters their resilience. Engaging our communities in civic processes is crucial for protecting our rights. Also, we can talk about securing diverse resources, because diversifying our funding sources is vital for maintaining independence and sustainability. This includes seeking private donations, corporate sponsorships, grants, and forming strategic partnerships. And the last but not least is policy advocacy, because engaging with policymakers to push for protective legislation and resist repressive policies is crucial for our survival. We should not only react to threats, but also proactively propose and support laws that safeguard our community. To conclude, I would like to say that by standing united and learning from these experiences, we can continue to advance the cause of justice, equality, and human rights. Thank you very much for your attention.
Thank you so much, Aleksei. And we're going to have a couple of questions, one for each speaker, but I just want to follow up, Aleksei, specifically to say, you talked about a lot of the things you've had to do to go underground, and I'm wondering if you could say anything about any positives that have happened as a result of this repression. In other words, any fresh alliances, any lessons to share now as we think about how to prepare ourselves and offer guidance to communities.
Yes, thank you very much for this question. In terms of fresh alliances, we had to look outside our bubble, so to speak. So we had to make alliances with NGOs from other charitable sectors, like help for orphan children, for example, or working with environmental NGOs in terms of reaching the Sustainable Development Goals targets. So yeah, it's you have to be flexible, you have to be creative, but first of all, you have to think about your communities.
Yeah. Thank you so much. I think that the idea of an intersectional strategy, which everyone knows is across sectors, is something we know is important with Project 2025, since it attacks nearly every sector. It does invite a lot of allies or people who will be affected no matter where you're living locally. I'm just going to turn to a question for Beirne, and then we'll turn to some other speakers. But Beirne, one of the things you really laid out all of the different possibilities of attacks. And as you said, it's very sobering and it's happening now. It's unfolding now. I'd like to ask on behalf of all the people who are in organizations, especially outside of the United States, what, if you can be more concrete about what you think the impact will be of this in terms of their funding, losing their funding, and what advice can you give them practically about thinking about this, whether it's risk assessment? What lessons do we have now? We've already seen with global gag, et cetera.
Thanks. So this is a complicated question that sort of starts with funding and the poison that comes with funding happen differently in US foreign assistance. So Congress controls how we appropriate funds. And so if it depends dramatically on who controls the House of Representatives and who controls the Senate about whether we lose PEPFAR funding as a community or we lose money for the global fund. That's going to depend on appropriations, and that's something we're going to fight for in Washington, D.C. Whether that money now comes out into the world with new restrictions that make it impossible for sexual and reproductive health and rights groups, groups that have human rights at their center, groups that are trans-led or trans-serving, that make it impossible for them to take the money, that's a totally different question.
Right.
They
but
don't want
practically, Beirne. I mean, people on the ground, what can they do?
But it totally depends. It totally depends on whether they feel like they can do the work and still take the money or not. That's the assessment you need to start doing right now. As it was on the slides, you've got to start doing those individual group risk assessments of, can we keep taking US money if these things happen? And if they do, what will we still continue to do and do the most that we possibly can?
I'm going to have a tiny follow-up question for you, Beirne, which is what roles could WHO, UNAIDS, the PEPFAR, the Global Fund take now to provide guidance, to provide their assessment and guidance to all the grassroots groups getting money that are, essentially impacted? What are your thoughts?
My honest thoughts are they have given terrible or non-existent advice in the past, and I don't know that they're the right people to do it because as big entities. I mean, honestly, yes, it is up to the community to be as bold and as coordinated and as smart as possible. They give incredibly conservative, terrified advice. They themselves are also scared of losing money.
Okay. So we have to reframe the narrative, and we need to put forward our global alliance as activists. Over to you, Allan.
So I still see no hands. Either we are all informed about this or we need to speak up. So I'll go to Buky and ask Buky, are you able to share any reflections around what lessons do we learn with the craze about hanging around first women, parliamentarians in Africa, pushing an agenda by the West, yet they're saying they want to have laws that are and policies that have African values. Could you please reflect on that and what people should do?
Thank you.
Okay. Just to also quickly say something about PEPFAR funding before I jump to the question, that it is, I think, apart from what Beirne said, which I do agree with, I think one of the things that organizations outside the United States need to pay attention to is that what does it actually say? Because one of the things we have seen is when the Mexico City policy comes back, is that it is often over implemented and often over pushed. And a lot of organizations are actually not aware of what the fine print is. And so one of the things we need to pay attention to is like, what is the fine print? Because it does not affect our governments who are still able to push for post-abortion care. Sorry, it doesn't affect our governments who are still able to push for post-abortion care and still able to support post-abortion care. So it's quite important for organizations to pay attention to the fine print and not let the fear and the scare push us into doing things we do not have to do because of PEPFAR. So very, very important to pay attention to that. So that's the answer for that. In terms of what our politicians are doing, and in terms of this lies around African values, I think there's an organization called CIRC, and I think they've done something really interesting, which is about really just exposing our politicians, right? So somebody like Peter Kaluma in Kenya, for example, who's pushing family values, but then was exposed for the fact that he doesn't pay child support. You know, so how is it African values if you're not supporting your families, and being able to get local organizations to be the one pushing that and having those conversations. I think for us, it's also been the fact that we also have to start the conversation with different groups, with lawyers, with doctors, with various organizations as well, to be able to say this issue around African values is affecting all of us, not just some. Because the idea behind it is to just say, oh, no, this is about LGBTQI rights. And it's those degenerates. And for many of us, it's to say, no, actually, this is a governance issue. This is influencing the way our governments are doing our work. This is also following the money that is coming from Russia, that is coming from the United States, that's coming from Family Watch. Who is it coming to, and what are they using it to do? And how are they destabilizing our countries? And I think that's really what a lot of us are paying attention to. So like, how do we use that information and how do we use the language? The last thing I'm going to say is that one of the things we've also recently been doing is also talking to organizations about what anti-rights movements are, because a lot of them are feeling the impact, but they don't know where it's coming from. Or they've seen it, but they don't connect the dots. So for a lot of us who actually know and connect the dots, our role is to now say, okay, this is why this is happening. Not just because of Project 25, but because of religious fundamentalists. This is their end goal, because Project 25 is not their end goal. That is just their strategy. So what is their end goal, and what does that mean for you? Even as a Christian, as a Muslim, as you organize, what does it mean for you? And how do you organize around that? So paying attention to that. And last thing I'm going to say is that we also need donors to care about these issues. Because you're giving us money to do advocacy, you're giving us money to be out in communities, but you're not giving us money to mitigate what we're seeing exactly from these groups. They're well-funded, they're well-resourced, they don't need to share receipts. They're not being asked to be accountable, but we are being asked to be accountable as we're fighting entities that have more money and more power than we do.
I just want to follow that, Buky, to talk about there's been a real chilling effect, as we're seeing in the United States, and funders concerned about AIDS, which is, among our sponsors here, have talked about this. They've done a report on it. You can take a look at theirs to talk about the fact that it's much more difficult to raise money, not just for LGBTQIA, but also for the issues around HIV. It's much a chilling effect. What you're talking about is the fear is a chilling effect. As with the DEI, companies are pulling out of funding LGBTQ activities, HIV activities, and we need to call them to the carpet on that. We need to raise that issue. We need reporting on it. It's happening domestically and globally. Allan, over to you.
Thank you, Essie, and thank you, Buky, for your response. Sean, I want to bring you in, and we note the comments that are coming through, and you spoke a lot, and I know you had more content around religious leaders. How do we, and what advice would you give for people on the call on dealing with the backlash and the influence that comes from religious leaders in the name of using religion to advance values that are not respective of human rights? Over.
Yeah, I think there's a lot that different segments of civil society can do right now. including exposing this agenda for what it is, which is Christian nationalism, the ending of church-state separation, which is an incredibly important principle of the American political system, imposing a narrow sectarian vision on the country and on the world, through foreign policy. State governments can pass state non-discrimination laws that include sexual orientation and gender identity. If a state legislator is not willing to do that, a state governor can issue an executive order, which can have some impact. But I think that foundations need to fund public education efforts like this, and really, get the word out about how dangerous this agenda is. Congress could, the House or the Senate could hold hearings. They could call in the head of the Heritage Foundation and ask him to explain this plan. Talk about how he plans to implement the criminalization of school librarians, or what about transgender people who are non-compliant, or LGBTQ people who won't go along with this agenda? What are they going to do with them? And how does that square with our U.S. Constitution, which protects which says equal protection of the law, due process, free expression, free assembly? All those basic individual rights are at stake here.
Yeah, I want to mention that we are in conversations, our campaign and others, with Representative Jared Huffman, who's working with Jamie Raskin, and quite a number of groups have proposed a couple of different things. One is something along the lines of a U.S. town hall on Project 2025. There is a plan to have hearings in September. I would urge all of you to get in touch with Huffman and Raskin's offices. They are among a group of what's called a Democratic caucus that's formed to fight Project 2025. I'll send to Jim later the connections for that. There's also working groups created that are focusing on legislation and the specific legislative asks right now. But we also definitely, I think, need to put the call out to our own HIV leadership now to pull together some real high-level meetings and other meetings for our communities to talk about the impacts and what is our kind of collective strategy as we move forward. I wanted to create, just to take one question that I wanted to give Will, and then we're going to turn to a few speakers that have, the listeners who have put in some questions here. Will, I think one question is really, we've seen this agenda unfolding very strongly. We've seen it in Florida. We're seeing it in Texas. We're seeing such an attack on the vulnerable communities. What are you seeing in terms of any kind of effective organizing or strategies, to kind of work intersectionally? And that would include also, I think, the faith communities, the progressive faith communities.
That's a good question. And I think that what we've been seeing in the South is it is a collection of these sort of groups getting together. There is concerted efforts to engage with people aging with HIV, the religious community and their intersections with HIV. And what that is creating, I think, is creating the ground for where any sort of structured counter to Project 2025 can be. Right. And it has to start with community. It has to start with community engagement and organizations working together to create some sort of cohesive wall against these continued attacks that are happening. And honestly, they're happening with more frequency in the South. Anti-LGBTQ legislation, anti-reproductive health legislation, anti-sexual health legislation, anti-trans legislation. And this has been going on for a few years, and it has picked up lately. Last year was record anti-LGBTQ legislation that was proposed throughout the nation, and most of those legislation was in the South. So I think that what needs to continue to happen is more engagement with organizations that are outside of the HIV sector, number one, and then two, continued engagement with community organizations, but really get them involved in the decision-making processes that larger organizations can take.
Can I ask you a quick follow-up on that?
Yeah.
Well, I think the question is critical also. We haven't talked about things like Medicaid and Medicare and Social Security, but all these things are being attacked by Project 2025. There's a concern around Medicaid coverage for folks with HIV, and everyone asks about Ryan White. Can you say what kind of conversations should we be having, or might we be demanding from the leaders at HHS and HRSA and things now about assessing the possibilities of these attacks? We know they're thinking about it. We need to be informing our communities. What kind of conversations might you have?
I think that's right on, Mark. I think we need to engage with our administrators and have them communicate with our communities the sort of impact that these sort of changes will have directly within communities. Project 2025 is asking in terms of Medicaid benefits, is asking for work requirements. These are things that we have seen in the past. Some states in the South have already implemented it. For example, Georgia, they haven't had success in reaching the kind of numbers that they wanted to see. There's actually been a state that has been losing money because of their implementation of work requirements. But despite that, efforts are continuing to be pushed throughout the South for 1115 waivers to add work requirements, and that is included in Project 2025. Like I said
think we need a list of some of this stuff. We need to make it be something that all the people in our community are seeing what this agenda is in these sectors. Thanks so much for that, Will. I'm going to turn it over to Allan, and we're going to take some questions from our listeners. Allan?
Thank you, Essie. I think the only question I see is from Sophie, and she's asking, and I think this could go to any of the panelists, whether there's been any conversations with pharma in any of the respective states or in any of the respective countries that are affected by this. So any panelists can jump onto it.
Yeah. I don't know which speakers will take that. I just want to note that one of the interesting notes about Project 2025 is that it seeks to renegotiate some of the prescription drugs, and it sort of highlights this as a positive point. But we're also seeing that overall it does incredible deregulation of most industries and removes a lot of the safeguards. So it's really giving a big tax break and a lot of funding to major corporations, and that includes pharma. But Beirne, do you want to take a stab at that?
Yeah, I'm happy to, and I hope other people have different answers. But I mean, I have had conversations with some of pharma, both on the big context, but in particular, the global gag rule applies to for-profit organizations. It applies to universities. It applies to for-profit entities, and even in some countries, their shareholder disbursements. The government and Project 2025 are very careless in how they write, and they're depending on all of us to create legality around it. So there's a lot of opportunity to tag in power players who have different roles and different interests, and try to get them to fight some of this fight for us.
Right. Sean, did you want to jump in on that question?
I haven't had conversations, but I do know that a lot of the pharmaceutical companies are funding LGBTQ supportive advocacy and healthcare provision and prevention work. And so, like Beirne just said, that's going to be implicated if this gag rule is put into effect, which is likely as an executive order if Trump gets into the White House again.
The only other thing I would note that's really critical, we did say we'd talk about science, and obviously not just the restrictions being put on all these different agencies. There's really a questioning of the authority, whether it's from the CDC or the FDA, but also the WHO and the UN agencies around science. It is an attack on science and evidence-based research, but specifically it also calls, in the areas of basic research for stopping federal funding of anything that has to do with any kind of fetal cell lines of research. And as well as the vaccine mandates. And that does impact on some of the farmers. So we're seeing pushback in the areas of this because many of these pharmaceutical companies have been involved, not just in the vaccine mandates for COVID, but think about this globally. What is this going to mean for epidemic control? This is a catastrophic policy proposal. And we need to engage science, and we need to engage the different associations of scientists to be speaking out, because the global public health implications are enormous, as are the domestic health implications. And we know this not only in our HIV areas, but whether it's STDs, whether it's COVID, whether it's polio, we need to both prevent future epidemics, and we also need to prevent the return of epidemics that we have already gotten control of. So I think that that's really critical. And again, engaging the scientific community. We have the International AIDS Conference coming up in 2 weeks. I'll be there. Allan will be there. We plan to do what we can to raise these issues. I want to just see if there's any final questions before we go to our closing comments here.
Yes, indeed, there is one from Sindra, which is, what is the current administration doing to protect against potential of 2025?
I'm going to mention that, and then I'm going to let that be some of our speakers. But we have been in constant conversation with groups who are working with us. We work actively with the Center for Popular Democracy, as well as engage with partners at other levels like the ACLU and others. There's been a lot of pressure, and I think people will probably notice who are closely watching this that on the eve of the debate, the Biden administration put up its new platform, specifically calling out Project 2025 and really making very, very strong the case that this is, while it's about, of course, for them, Biden, what we're really talking about is an agenda that is anti-democratic, that this is fundamentally an attempt to dismiss, dismantle the U.S. System of government. It's really a complete attack on the system checks and balances. If Project 2025 were enacted, if they could, for example, replace tens of thousands of federal government career civil workers, what we'd have is a hollowing out of the U.S. government. We would have inexperienced partisan people in charge of all of our major sectors, including things like our nuclear policy and others, incredibly dangerous. And we all need to speak out about this. We need to make our media aware of it, and we need to raise a lot more noise. This is an attack. So are there any other speakers here who want to take a stab at the Biden administration's position?
I would just say, the Biden administration has implemented a number of critical policies that protect LGBTQIA plus people, that advocate for, that promote health equity and sexual health, HIV and STI prevention and care for our communities. And it's just really important to understand that. I don't know that there's a lot they can do to preempt and prevent against some of the proposals in Project 2025. But it's just important to get that word out as well, that we've seen incredible advances under this administration, under this president.
I will say that there are some legislative actions that can be taken. One of them, though, it's being stalled, that are asking people to put pressure on, is the possibility, even though it's not being put on for a vote before November, is the Save the Civil Service Act. That single act could prevent a lot of this, because they would be unable to necessarily overnight or in a matter of months essentially fire tens of thousands of federal workers. So that's a big one that we can go after. And I want to mention the working groups that are being convened by Democracy Forward. Those working groups you should check out if you're working in any of these areas of legislation, weaponization of government. That's where they've created a threat matrix about Project 2025. That's where groups are taking on different parts of the puzzle. And that's where you can see who is doing what. And so we really want to urge you. My message to everyone is, it's time for you to join the resistance if you feel like you're not already in it. And there's a lot we can do, and we do need to work intersectionally. I'm going to put up our last slide here just to say that there's a couple of things that we also want to urge people to be able to do. Jim, I think, can you see our last slide here?
I cannot, Christine.
Not yet.
Christine.
I'm going to see if I can share it again. Share that slide. Is that coming up for you?
No.
Hold on one second. Have you got it now?
There
yes.
it is.
Okay. I think the quick messages that we have in our campaign: one, read the plan. We provide short summaries of 2 pages because nobody wants to go through a 900 and whatever pages of dense readership, but we've provided short summaries. They're in Spanish. We're putting them in French. We invite you to share them. And we also have a lot of social media, so you can get the message out that way. Tell others, obviously. We urge you to host town halls like this one and bring together intersectional actors. We're doing one at the end of the month with Latinx Plus and HIV activists and health activists around Latin America. That's also for the Latino community. We need to get the message out in Spanish languages that are very affected. That's something I'll talk about with other groups like Will and Sean, et cetera, really mobilizing the Latino communities in the United States. And again, prepare your NGOs. How will this impact you? What might you lose? Think about stockpiling resources, fostering new alliances. Those are the kinds of actions we need. What might get lost in your community? HIV medicines, reproductive care medicines, prevention. Who can provide those now? Assess it, have the conversation. And finally, while so many are targeted, we have so many allies. There is strength in numbers, as Buky and others have mentioned. Pool your resources and build solidarity. And finally, we invite you to learn and apply the lessons of your own community with us and others. And I think the last part of it is whether or not it's a Republican or a Democratic victory in the fall, we also need to talk about what we want. And that's why so many young people are feeling disaffected. What do we want? We need to talk about it and fight for it. This is a moment where, as we tend to quote, I tend to quote the Einstein quote, which is that in moments of great crisis lie great opportunity. And that has been true of every movement. We can look at our own HIV movement. We have incredible lessons from our own HIV movement, the civil rights movements. Black Lives Matter movements. Look at what's happening in Uganda, as Buky's talked about. Incredible lessons. So let's invite the lessons. Let's champion the voices of those most affected and marginalized, because the people who are most targeted have the most at stake. And as Aleksei has pointed out, we need to be able to bring forward their voices, even when they are underground, even when they are in situations where they may not be able to speak out as openly. You will find community leaders in many places, and we are in that moment. So I'm just going to take off this slide and to say that we welcome you to the resistance. And I think that we're all here, and all of you here have so much to bring to this. So really want to say, take heart. We have seen and identified incredible lessons at every level. We're bringing them forward as fast as we can. And we invite you also to spread the message, and please invite us to the forums that you create as well. And we'll keep working, and you'll see us at the IAC, and we'll continue to spread this message. So I'm going to give Allan your final thoughts.
I think you've summed it out all in terms of the intersectionality of the movement, spreading the word and keeping the message on board, and of course not forgetting the views and the voices of young people. We've seen what's happening in Kenya and the ability of young people to be able to unite across class, across tribe, and that is something we need to do in the HIV movement alongside other movements.
And
a huge thank you to all.
People, we are the majority. In the United States, we're the vast majority that does not support Project 2025. When people learn about it, they don't support it, even when they're Republicans. So that is the message. We have 3 take-home messages we want to share. 1, Project 2025 is a threat to all of our freedoms. Number 2, it would dismantle the system of checks and balances in the United States. And number 3, it's a major attack on women and on reproductive health issues and on choice and bodily autonomy, as Beirne and others have pointed out. So that is the message. We have 3 take-home messages we want to share. 1, Project 2025 is a threat to all of our freedoms. Number 2, it would dismantle the system of checks and balances in the United States. And number 3, it's a major attack on women and on reproductive health issues and on choice and bodily autonomy, as Beirne and others have pointed out. And we need to get that message across to people. When they know about Project 2025, this is personally going to impact them. And we need to bring that message forward. And we need 3 or 4 months to do it. So everyone, let's get moving and let's work together, and Godspeed.
Over to you, Jim, for the wrap-up.
Thank you so much. Thank you. Thank you. We want to thank all of our participants. We had almost 400 people registered today. Close to 200 joined us online. Many thanks to Allan and ACD for superlative moderation of this very dense panel. Thank you to our wonderful panelists, including Buky, Aleksei, Will, Sean, and Beirne. All great information. All of these folks' slides and the recording will all be shared with you in the next day or so. We're also collecting all the information from the chat. That'll go into a resource document. So, and the chat is recorded. So all of this stuff will be available to you in the next day or so. And I think I will just echo what Anne-Christine and Allan and everyone else has been saying, is get involved. This is not the time to sit on the sidelines. I've personally been very concerned seeing very few folks in the HIV space tracking on this. I know we have a hell of a lot of stuff to put up with. As Beirne calls fuckery, there's already so much fuckery on our plates. What more can we take? But Project 2025 is an enormous threat, and we need to mobilize against it and prepare for whatever happens, whether it works or not. We have a lot to do. So please engage, stay in touch, and thank you for your time today. And with that, we are going to officially close this webinar. Give some love to all the people I just said, including all of our amazing co-sponsors, and we'll see you on another webinar very soon. Ciao.
Thank you so much, Jim and AVAC.
Thank you. Bye-bye.
Thank you. Bye-bye, everyone.
Thank you very much.